When clients come to me and say they want to lose belly fat, that their goal is midsection fat decreasing, what they can see in the mirror, I usually tell them, great, but what about what you can't see in the mirror? And that is visceral fat. This is the fat that surrounds your organs, leads to chronic inflammation, insulin sensitivity, hormonal disruptions, a whole slew of chronic diseases that you may not even be thinking about. And yes, visceral fat could also be the reason that your midsection is protruding a little bit, but to me, the health implications of visceral fat are so not talked about enough. Today, I'm going to explain what visceral fat is, how it accrues over time in our body around our organs, and what I would recommend you do today to start losing it. If you don't know me, I'm Megan. I have a Master's of Science in Health and Chronic Disease. I've been a certified personal trainer for over 15 years, and I help clients online as well as in amazing medical clinics and gyms lose weight, really take control of their metabolism, and just get their energy back and feeling good. All right, let's get into it. So first, what is visceral fat? There is subcutaneous fat, and that is directly under the skin. You can see it, you can pinch it, you can feel it. And we all have some subcutaneous fat, but where the issue really lies is the visceral fat proponent. And that is going to be the topic we talk about today. Visceral fat is stored deep in your body, and it is within your abdominal cavity, wrapping around vital organs like the liver, the pancreas, intestines. And unlike subcutaneous fat that's really jiggly and right underneath the skin, visceral fat is metabolically active. And that means it can actually alter the way your body performs. And the way visceral fat actively alters how our body functions is kind of insane. It can alter our hormones, both men and women, leading to hormonal imbalances. Visceral fat is also directly related to inflammation because it can secrete inflammatory proteins that raise blood pressure and damage blood vessels, which can actually increase the risk of heart disease and stroke. And then there's a whole list of systemic health risks that have been studied for years, and how visceral fat is correlated to so many health issues, metabolic syndrome, dementia, even certain types of cancer. So this visceral fat is a really big deal, and I just feel like most of the clients who come to me know they want to look a certain way. You know, you want to feel a certain way, and I love that, but they don't understand. When I put them on a smart scale and we look at their visceral fat, we talk in depth about the health risks associated with visceral fat, because this is something that I think most people should know. Because if you're serious about taking control of your health, you need to know, what is visceral fat, how much do I have, and how the heck am I going to get rid of it? And research after research shows that people with higher visceral fat levels have a significant risk of developing insulin resistance, type 2 diabetes, fatty liver disease, cardiovascular disease, metabolic syndrome, and as I mentioned, even certain types of cancer. Now, here's the part that most don't talk about. How do we gain visceral fat? Because if we can learn how we gain visceral fat, then we can also talk about how do we lose it? How do we address it? And you might be surprised to hear this, but if you've been on my channel for any amount of time, you probably know that I'm not going to just blame this on calories in, calories out. That is not how visceral fat works. I will be very adamant about that. So if your trainer, if your nutritionist is saying it is all calories in, calories out, you need to step back and think about this a little bit deeper, because there is so much current research that talks about the health decisions we make on a day-to-day basis and the relation to the visceral fat buildup in our body. So how do we gain visceral fat? Well, it really boils down to about 4 topics. And I'm going to make this pretty quick, but the first one is going to be stress. Chronic high stress, unstress. Now, stress is like death and taxes. It's basically going to happen to all of us at some point in our lives. We are always going to have some amount of stress. And if you're listening to this and you say, I don't have stress, well, I'd really love to know your secret, or you're in complete denial. So stress, specifically unmanaged stress, the stress that really takes over your body, the stress you can feel, the stress that might keep you up at night. Chronic stress is associated with increased visceral fat because it influences appetite, sleep, activity, insulin sensitivity. And then we have to talk about cortisol. Cortisol, our stress hormone, when that becomes unmanaged throughout the day, because we're always going to have cortisol, and we want a good cortisol rhythm. You don't want no cortisol. You don't want high cortisol. You want a nice cortisol rhythm throughout the day. If that cortisol rhythm is consistently too high, consistently too low, or it's going up and down all day, research will tell us that your likelihood of visceral fat is going to go up and up. So we need to get a better control of our stress. If you don't handle stress well, find a practice, get in nature, talk to a therapist, mindfulness. There are some great apps out there. There's even some really good neuroplasticity programs that I always link to in my descriptions. If you're interested in those, there are some wonderful ones out there that can really help with your body's ability to manage stress in real time. So first way we gain visceral fat, stress. The next way that visceral fat builds up over time is exercise or lack thereof. Now, specifically, we want to focus on good quality strength training. So whether that is utilizing your body in strength, building muscle through weights, machines, anything I'm talking about here, you need some sort of strength training because more muscle means better insulin. Better insulin means less visceral fat. I really simplified that, but just trust me when I say if you strength train, and I've seen this time and time again, your visceral fat level will be lower than the person who does not strength train. And then on the other side is get your body moving. Some cardio, some walking, some biking. Now, I tend to not over recommend high intensity interval training for my women because that can disrupt cortisol, which can then be related to visceral fat levels that are a little bit too high. But some people do fine with some high intensity interval training, things like that, and not having disrupted cortisol and visceral fat. That's really more of a bio-individual thing that I go client by client knowing if I am recommending HIIT training. But for general population, strength training and then some sort of cardiovascular activity that gets your heart rate at least mildly elevated, like walking, biking, swimming, all of that great stuff. Okay, the third how of visceral fat accumulating in the body is food quality, specifically ultra processed foods, liquid calories, alcohol, candy, sugar. I mean, this should be obvious, but I'm saying it, so maybe it's not obvious, and that's okay. But let's take candy, for example. Candy is loaded with refined sugars. And then when you consume too much sugar, your body cannot immediately use that sugar for energy. So then what happens is the liver processes excess and converts it into triglycerides. And then these fats are then deposited deep in the abdominal cavity. And I think you can know from there that fat is the visceral fat we're talking about. And the American Heart Association has some great research that has linked daily consumption of sugary foods and beverages to a significant increase in visceral fat. So the more sugar, the more candy, the more frappuccino, crappy drinks that you have, and alcohol falls under this too for certain reasons as well, and that can be tied with sugar, the more likely you're going to have more visceral fat. And then the last how of visceral fat accumulating in the body is going to be sleep, specifically sleeping less than 6 hours a night. Research has shown time and time again, you sleep less than 6 hours a night, you are more likely to have higher levels of visceral fat. Now, we can talk about the how in this and get really nuanced, but I'm going to generally say get a minimum of 6 to 7 hours of sleep a night. Go to bed in a cold, dark room. Don't scroll on your phone for hours on end. Shut it down, relax your mind, get that sleep. Because at the end of the day, if you are sleep deprived the next day, your stress is going to be higher. You're going to have more cravings for carbs and sugary foods. You're going to be more likely to make crappy decisions. It's all related. So sleeping and sleeping adequately and sleeping deeply will help us not accumulate visceral fat over time. All in all, sleep, very important. Now, here's some really good news. Visceral fat actually responds very well. And I have helped a lot of clients decrease their visceral fat levels, and it does not take as long as you would think. And if you like this video and want more metabolic knowledge by me, hit the subscribe button. One of the coolest facts is that your body starts targeting visceral fat pretty quickly when you start improving your metabolic health. So this is great. And I've seen this firsthand, and it's really exciting to me because not only do I help my clients look better, but they feel better, and then they decrease their overall risk of hundreds of chronic diseases. That's a big deal. So what's the action plan, you're asking me? Megan, how do I decrease visceral fat? Lift. Lift large muscle groups 2 to 3 days a week, 30-minute sessions minimum. It doesn't need to be anything crazy. Work on compound movements. They get you more bang for your buck. Squats, deadlifts, push-ups, rows, pull-ups, planks. Use your large muscle groups and show your body it's alive. Lifting 2 to 3 days a week, 30-minute sessions. If you're uncomfortable with that, get a trainer, go to a class, invest in yourself. Strength training is one of the best things you can do for your physical health and also your mental health. The next thing is find a form of cardio you love. If you like walking in nature, great, do it. If you like biking, break out the bike. If you like swimming, maybe you have joint issues, maybe you have knee pain, get to swimming. But get into a cardiovascular routine that's mild to moderate. It doesn't need to be crazy sprints, HIIT training, etc. Do it 20, 30 minutes, preferably every day, but at least 4 to 5 days a week. The next step is focus on whole foods. Decrease the alcohol, the sugar, the cakes, the candies, the bread. You're not benefiting yourself by taking any of those foods in. And I'm a big in moderation girl, but all of us just about can decrease the consumption of those ultra processed foods and increase protein from animals and fish, healthy fats like avocado, grass-fed butter, olive oil, all of that great stuff. Make sure you're having local produce, fruits, vegetables. This is not rocket science. Most of the meals I make in my kitchen take me 15 to 20 minutes or less. If I had to be in the kitchen any longer than that, I wouldn't have a job. This doesn't need to be complicated. Eat whole foods, decrease ultra processed foods, sugars, etc. If you're having a hard time with that or figuring out what to eat, reach out to me. I always have a link in my descriptions with how to work with me, my call calendar, all that great stuff. And then the last piece of advice would be get your sleep and stress situated. Figure out your sleep. If you're having trouble sleeping, figure out, is it something related to a nutrient deficiency, a mineral deficiency? Is it your sleep environment? Is it your stress? Do you need a better stress outlet? Do you need to figure this out with a professional? But stress and sleep are very, very much tied into all of this. And it's hard to eat right and exercise and have the energy for it if your sleep and your stress aren't managed. So this is all tied in together. And ultimately, remember, try not to chase the number on the scale. Chase metabolic health, because when you really ingrain yourself into being metabolically healthy, into making these lifestyle changes and realizing this isn't a diet, this isn't a deadline, this is a lifestyle. This is you learning how to take control of your health, how to really celebrate your body, how to feel better day to day. All the other stuff like looking good falls in line pretty quickly too. So if you're serious about improving your metabolism, subscribe, because that's exactly what I do here every week. And if you'd like personalized help, you can learn more about working with me one-on-one using the links below. Thanks, everyone.